Contract relax is a proprioceptive neuromuscular facilitation stretching technique that utilizes active inhibition via the Golgi tendon organ, activating to promote inhibition of the antagonist muscle, in this case, the plantar flexors. To perform contract relax of the plantar flexors, the patient will start in a supine position. The therapist will then passively move the patient into dorsiflexion in range to where the patient can feel a comfortable stretch. Do you feel a stretch with that?
Yes.
The therapist will then instruct the patient to submaximally perform an isometric contraction of the plantar flexors for 5 to 10 seconds. The cue is, press your ankle into my hand like you're pressing down on the gas pedal. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The patient will then relax without moving the ankle into a new range of motion. The therapist will then ask the patient if they can take them further into the new range of motion. Is it okay if I move your ankle further towards you?
Yes.
The therapist will then move into the new range of motion and hold for 30 to 60 seconds. This will then be repeated 3 times. The therapist should be cognizant of possible adverse reactions to this intervention, such as over-lengthening a muscle, causing deformation or a strain. To regress the contract-relax PNF technique, the therapist can instruct the patient to do a simple static stretch of the plantar flexors. To do this, the patient will be supine with their ankle off the treatment table. A stretching rope will be placed around the plantar aspect of the foot, and the patient will pull the rope slowly, moving the ankle into dorsiflexion, providing a stretch of the plantar flexors. The patient will hold this stretched position for 30 seconds and then relax. The patient would do 3 sets of this. This is a regression because it has less mechanical stress on the contractile tissue and lets the patient determine a comfortable range for stretching. To progress the contract relax of the plantar flexors, the PT can have the patient perform dynamic or ballistic stretches of the plantar flexors. To do this, the patient will step onto an elevated surface and then drop the weight onto their heels, lowering themselves into dorsiflexion. This will increase the range of motion and the force of the movement, making it a progression from the PNF.